Thank you very much for having me here. For me, it's quite a moving event because exactly 25 years ago, I graduated here from Kennedy School doing my master in public administration. So to come back after 25 years to this city and to this event, thank you very much for the opportunity. I used to call my lecture From Illegal Substance into Promising Medication. It's a process that we are only beginning, and it's a fascinating process, and we must do it. As it was said a minute ago, we are not supposed to wait to collect all the proofs and all the data. We have patients. I'm a family physician, an active one for the last 40 years. Tomorrow I'm flying back, and Friday morning I'm going to see patients again. I believe that a good administrators in medical services and researchers should see patients in a while. That will give him the perspective of the human relationship and all things involved. Now, Israel became kind of pioneer in this process. I think we owe all the thanks to Professor Meshulam, who was the first one to describe, to find THC, and his research are guidelines for us all this time. We work with him even today. And in two occasions that I attended, I was told by other people, not Israelis, that Professor Meshulam ought to have a Nobel Prize for his work, but that he will never, I'm sure this audience is sympathetic, but he will never get it because of this is being such a sexy but also problematic issue about recreational use. I told this story to Professor Meshulam, and he laughed very much and said, unfortunately, those who think so are not sitting in Stockholm in the institute. Israeli 8.5 million population. During the last 10 years, we approved almost 50,000 licenses. I'm speaking about license because Israel is also obliged by the International Convention of Narcotics, and we cannot allow it to be medication until the international approach will be changed. And I believe that you, with your research and with the change of the attitude of the American states, one after the other, United States should lead this change in the international bodies, and then everything will be a lot quicker. At that point, in my office, since being the chief medical advisor to the Israeli Minister of Health, I signed all those licenses. Once again, not a prescription, but a license to have illegal substance for medical purposes. Every day on my desk we have between 200 to 300. Now we have a holiday, Passover, as you know. So I'm expecting, coming back after the holidays, to have about 2,000-3,000 requests on my desk. Of course, I don't do it by myself. 27,000 are active patients. Active, I mean they took the substance from the dispensary during the last 3 months. We were speaking this morning about the process. There is a tremendous pressure from the media and from politicians in Israel, I mean, but I suppose partially it's also here, to promote the cannabis usage. For the last 2 years, we have a health minister, Rabbi Litzman, a religious Jew, and when he came to the office, I asked him, please, I need to update you for new things that's in the market, in the medical field. And his first reaction was, he calls me Mickey, we worked together in previous assignments. He calls me, Mickey, I don't want to hear a word about it. It took for him 2 weeks in the office to call me urgently, please come here, I want to know everything about it, because every media person, every politician doesn't want to speak about anything else, just they ask me about cannabis, mostly for members of their families. And this is a very crucial point. We presented our minister a plan, which was later on adopted by the government, and since then we are promoting this area. I'll mention it later. We are very enthusiastic about research. I serve as a member in the research committee, which we have the honor that Professor Meshulam is the chairman of this committee. And during the last year, we approved 130 research proposals. 30 out of them clinical studies that are now in process. I'm not going to speak much about it. You know this single convention of narcotic drugs. The Israeli legislation can be something which is different, but the governmental decision allowed us to use it according to the Ministry of Health indications, instructions, rules, whatever you want to call it. And all of them are published in our web, so every physician and every patient can look and say, look, according to the ministry instruction, I'm entitled to cannabis, and they do it. We have a problem with old-fashioned physicians. As you say, you can't teach old dog new tricks. That is the verb. It's difficult. I go from one meeting to another in hospitals, HMOs, weekends. My wife likes it very much. We spend the weekend, I give a lecture, and trying to teach, but nothing is mentioned in medical schools, and that is part of the problem. Another problem is this mix-up of issues. Like we talked this morning, there is this recreational issue, there is the medical. I'm on the medical side only. Each time I appear in the parliament, being the representative, the senior representative of the Ministry of Health, the politician asks me, what about recreational usage? And my answer is always, look, I'm a physician, I'm in charge of the medical part. The recreational use is a social decision that should be done by politicians, elections, whatever you say, not by me, not by physicians. But when they press me, well, you cannot sit here as a senior representative of the ministry not having an opinion. Then I say, okay, it will have its costs, like in alcohol, like nicotine. The social decision was that you can sell liquors to every person over 18, okay, you have the results. Cannabis is a lot better than alcohol, but it has its own price as well. I'll mention it later. Just few numbers, the evolution of the numbers, number of requests that during the last 2 years, I'm in my office for the last 4 years. It was increased from 32,000 to almost 55. Licenses, as I mentioned, almost 28,000. Average amount, and this is very tricky figure, because I'm never sure exactly when we approve 20 grams, what is the percentage of THC or CBD in those grams. So this is quite a tricky number. In our instructions for the next year, it will be mentioned very specifically. During the last year, at least legally, we dispensed almost 1 ton of cannabis, 928 kilos. The average amount for patients is 33 grams. I have some heritage from my friends that were running this subject before, with people getting up to 200 grams a month. Personally, I have doubts about the person using such amount alone. They usually have help. The evolution of cannabis. As I mentioned, more patients, smaller doses. It is not worth photographing. Ways of administration. Well, one of the pictures disappeared. Most probably illegal picture. Inhalation, sublingual and oral. We didn't allow until now skin preparations, and we are very afraid of cookies. Our general director of the ministry was very concerned about the problem that the grandchildren eat grandma's cookies, which could be bad. I want to mention that if you think how do you want it to be taken, well, there is a development now of an Israeli startup. I will not tell the name, and I don't have any part in this company, unfortunately. They prepare inhalers. You all know this inhaler, like Ventolin, all those asthma treatments. They have this inhaler with small heating device. I suppose most of you know that in order to reactivate the substance, you need to heat it to 184 Celsius degrees. So they built a small device which makes the heating, and then he can inhale exact amount, very efficient, and I hope that in the next few years we will stop this smoking issue, which as a physician I don't like it, and give it in inhalation or many in other ways. How to get cannabis in Israel? We have a very structured process. Every specialist in the country can recommend a cannabis within his own specialization. Oncologist, pain control physician, neurologist, pediatric neurologist, psychiatrist. He needs to fill a form, a computerized form, and send it to our office with the whole medical history of the patient. Why I insist on the medical history? Because many times the prescribing physician, who is a very distinguished specialist and he knows everything about neurology, he knows nothing about the psychiatric condition of the patient or his lung situation. So for that purpose, I insist on having the whole history of the patient, which we can check and approve the usage. In case of psychiatric history, well, here I come to the main contraindication today: severe psychiatric problems, a history of addiction are, in our opinion, a relative contraindication. Why I say relative? Because some psychiatrists can say, okay, he was once, he has a problem, and now he's okay, we can give him cannabis. If he's in unstable condition, maybe not at that time. We have difference of opinion. Dr. Resnick, who is here, he believes that it's almost not existent, very small numbers. Others say more, but some say that between 1 to 10% of people, of patients with pre-existing psychiatric conditions, they tend to be, not hospitalized, but they need treatment. So this is today the most significant contraindication to medical treatment of cannabis. And I believe that in a few years that we'll know more about the subtypes. I mean, about maybe some types of THC will be consistent with this situation, but I don't know yet. I have 15 physicians working for me. They see all the applications, and after they approve it, it comes to my signature. Unfortunately, I'm the only one allowed to sign it because all other physicians refused. Why? Because there was a tremendous pressure, intimidation for them. You must approve it, otherwise. So I got all the pressure on me, and my wife got during the night all the phone calls, the nasty phone calls, telling her what they think about my mother, which is not true, I promise to you, but we survive. The license, after I signed, is transferred to one of the 8 companies. Today we have 8 companies distributing cannabis to the patients. At the beginning of treatment, each one needs to have teaching, 1 hour teaching how to use it. We found that in many cases, people didn't use it correctly, and at that point, they didn't enjoy the treatment. After after they learn how to use it, the percentage of success is very, very high. Since it is a license, and since we want them to be followed by their physician, we ask to renew the license, I mean to renew the request for a continuation of treatment every year, sometimes every 6 months in special cases. This is basically a medical decision, what is the interval between the follow-up meetings. Increase of dosage. During the years, most of the patients ask for higher doses of cannabis. We decided that it will be done gradually. I saw one of the presenters yesterday, they said start low and increase slow, something like that. And yes, this is what we believe. I wanted the follow-up responsibility to be transferred to primary care physicians, family physicians like me. They're afraid. They're afraid because in those places when it was started, a lot of people came to ask for cannabis when the physician didn't think it was appropriate. The moment you have 2 markets, one medical market, one recreational market, of course there is kind of a leakage and kind of influence. I mentioned 28,000 patients being treated. According to our estimations, we have 1 million people who use cannabis for recreational use, once a week, once a month, during the party, whatever. And our medical cannabis has a reputation of being a good one, so they try to buy it. And for some patients, it's quite a temptation to sell part of the stuff. Indication. We have an indication committee, which I gather once a month, every 2 months. Each time I ask the physician to prepare homework, the best physician in this field. They prepare the homework and suggestion for decision. We discuss it, and then if it is approved, it appears in our web as an indication, as an approved indication. Sometimes people ask for cannabis when they do not fit the indication. So it's not entirely my decision. We have a pill committee, and all those cases that fall between the chairs, we discuss them. In the last meeting, we had 60 requests, and 54 out of them were approved. So we really try to be open to things that we don't know enough about. This expert committee evaluates the indication and the old one. In one case only, glaucoma, the American Ophthalmology Association decided that it is not useful in glaucoma. It does not reduce the intraocular pressure, and they stopped or canceled the indication. We followed them, and this is the only case I remember that we abolished or stopped existing indication. Oncology, 40% of our patients are oncology patients. I don't have to mention many things. You know, it helps them to stop vomiting. Usually you can stop the opiates and they don't have constipation anymore. They can eat, they can sleep, and they look better. And I find myself in the parliament answering question, why don't you allow cannabis for a treatment of cancer to all the patients? And it is not that simple to explain to parliament members the difference between treating cancer and treating symptoms. And I really hope that in the next few years we'll find what types of cancer, how can we help them with cannabis. For the time being, it's symptomatic treatment only. Primary and secondary metastatic pain, of course, end of life, we do try to be as quick, as helpful as possible. There is quite a problem with discontinuation of treatment. For example, if I have a lady after mastectomy, she was given cannabis because being an oncology patient, and after 5 years, she is perfectly okay. As a physician, I believe she is completely cured. But to stop the cannabis, it is a problem. Not that much about habit formation, but kind of dependence. I don't know how to call it, but it is quite a problem. And believe me, it's no good to argue with an oncology patient, especially if all the media focused on your face. Palliative treatment, about 30%, are for treatment which was for intractable pain. Our instruction, we demand that the patient will be given all the known medication, not all of them, but some of them, and only if you fail with the regular, the known, the proved treatment, then you start cannabis. I really believe that in a few months or a year, we will change this rule, and cannabis will become a first-line choice for treatment, not after exhausting all other possibilities. Well, the market is full of promises, full. You have advertising telling people that cannabis will cure every disease you have. My friends used to say that even it will bring you back your lost love. I'm not sure this is a proper indication. Neurology, multiple sclerosis, Parkinson patients suffering from chronic pain caused by rigidity, Tourette syndrome are unbelievably successful. The treatment is an unbelievable success. I mentioned the problems of psychosis. Epilepsy were approved for adults lately. Neurology, it was mentioned yesterday, and I was very impressed. We have the same results with epileptic children, autistic spectrum. They have a problem how to define the spectrum, which is very wide and very undefined. We have now more than 250 children treated for intractable epilepsy. A few months ago, I asked the specialists to present results, intermediate results. More than 50% of the children were, well, if not convulsions-free, so less than 5 convulsions a day. I mean, those kids that started with 200-300 convulsions a day. 30% the number of convulsions went down to less than 20, and about 10 to 20% didn't enjoy the treatment. Well, I'm a physician. If somebody will tell me that you have a treatment that's good for 100% of patients, I wouldn't believe it. Neurology, ALS, Lou Gehrig disease, fibromyalgia, which is quite a problem because the disease is not defined enough. You don't have laboratory tests, no other. Crohn's, I'm running. Gastroenterology, ulcerative colitis, very good results. Psychiatry, we have more than 1,500 people, most of them victims of war, soldiers, treated for PTSD, following unsuccessful psychological and other treatments. They enjoy it very much. Almost all of them continue the treatment. I mentioned ophthalmology. We have a problem with pain clinics that are overcrowded. I mentioned our health minister, Litzman, which he was the one to present it to the government. He got its approval. Just shortly, the numbers of our patients, 8,000 of them are treated for oncological problems directly in the hospitals. The rest, as you see it, oncology, Crohn's disease, neuropathic pain, HIV, this is kind of symptomatic treatment for very difficult cases, and PTSD I mentioned. Controversial issues which we have problem with are the driving under influence of cannabis. We don't have enough data to make decisions. I hope maybe you have, but I didn't see it. Place of treatment. This is, you do recognize them. I was asked by the hospitals what to do about treating patients smoking cannabis inside hospitals, because the physicians, some of them do not like. The rule I made is that only with the approval of of the physician in the department, he can use the cannabis. They have the problem of smoke alarms in the room. Export, I believe that we'll come to that when we'll make a medication out of it. We wanted very much to start the export, but our foreign ministry was very much opposed against it, because they were afraid Israel will be portrayed all over the world as a country exporting weapons and cannabis. That is not good for our image. So if I finish, we are going from substance to medicine, startup, and just one short story about older patient, and she was given cannabis for dubious, for not quite understood diagnosis. So after months, our people called her, asking, "Grandma, does it help you?" And her answer was, "Look, for the diseases, I don't know, but my grandchildren are coming to visit." Thank you.